As you look at the future, what excites you most as a chief medical officer, as a industry practitioner, because you obviously want to care for the consumers using these tools. What excites you the next decade or so, I guess?
Yeah, it's the Clay Christensen principle, right? What you want to do when you innovate is make something be more affordable and reach more people. What excites me the most in healthcare with the use of technology, with partnering with allied health professionals, clinicians across the spectrum, is that today we have a lot of people who can't access healthcare, where it's either not affordable, it's not available in their communities, where it's hard to understand healthcare. There's an IOM report, Institute of Medicine report, that came out a number of years ago that said the average American, and by the way, whether you've gone to college or not, understand healthcare at a sixth grade level. And so the opportunities in the future for everybody, because everyone's got a smartphone and because we're utilizing technologies in healthcare better, to no matter what community you live in, you can have questions answered in a way that you can understand. So it's making sure that we can curate information properly and making sure that it's health literate for everyone. That's not something we've done a great job of, right? A lot of people use Dr. Google, but it's not curated. So you really need to be able to do that. That helps people in the comment I made earlier about, do I need to go to the emergency room now, or can I wait? Chat functions between healthcare professionals. And can you imagine it's 2 o'clock in the morning, you wake up and you've got a Charlie horse. For all of you, this happens to me all the time. But for a lot of people with chronic medical conditions, well, is this serious? Is it truly just hydration? I have a history of having clots in my legs before. What do I do? The opportunity to do a chat with a nurse or a physician right there at that time because of telehealth services changes everything for you and your family at that time. So it's not a delayed response. That's powerful and cost effective because it's a lot less expensive than going to an emergency room. And in the long run, if we're really able to have people curate their data, think of a world where everyone knows the medications that they're on. And more importantly, it's so accessible that no one will ever give you something that you're allergic to. And we eliminate that category of people dying or becoming really severely ill because something they were allergic to, no one knew and treated them for it. The power of that for us in healthcare, for me, I don't even think of it as, something we're imagining. That's why we're doing this work. And for everybody, it's not based on your price point. It's we can do this and improve healthcare for everybody. That's why we're doing this. That's why technology is so important.